I'm Deepthi. Just like Hannah said, I am a physician from India. Actually, my next slide has some introduction about myself. So I'm a physician. I was trained in India and I have about 3 years of clinical experience in India. And I have moved to the US 3 years ago to pursue my master's in public health and subsequently went on to pursue professional science masters in biomedical and health informatics. Like Hannah said, some of my interests are data analytics, health economics outcomes research, precision medicine, and medical technologies. So these are, you would see why these are like my interests and like how I would have connected all of my previous experiences and everything to work on the internship projects. And my faculty advisor for the program is Dr. Fayu. So for the completion of my internship requirement, I have taken up 2 internships over summer 2021. And the first one is Alva 10, wherein I worked on 2 projects, predominantly on breast cancer, but also beginning of atopic dermatitis project. Those are the 2 disease areas I worked on like over summer. And Enable is the second internship wherein I acted as a instructor of basic data science course, like for the boot camps over summer. Firstly, I would want to talk about Alvaten. So I would only be speaking about breast cancer for the sake of conserving some time. So firstly, I would want to give some background about Alvaten. Who are they? So Alvaten is a company which is basically a Boston-based consulting firm. So at Alvaten, they call themselves friendly brokers, like who are disinterested middle organization who help efforts of precision medicine efforts of diagnostic as well as payer, diagnostic companies as well as payers. So what they do is basically develop evidence-based scientific models in order to support economic decisions. They would want to, they bring up economic data points and then they back it up with scientific decision points. And with the help of all of that, payers and diagnostic companies are able to place themselves better to decide how to go about launching or rolling out diagnostic technologies. And like I said, their main clients are payers and diagnostic technology companies. And also futuristically, it is helpful for researchers because they sort of point out what areas of interest are for further research. So on the breast cancer project, the basic role I had played are evaluating clinical and economic burden of breast cancer. And this would subsequently drive precision efforts in disease management of breast cancer. This is an overview of what all I would be speaking about during this presentation. So I would want to start off with a case study to illustrate how exactly this project or this tool that I'm going to be speaking about fits into the context of precision medicine. So over years, we've been seeing a lot of health insurance companies invest and acquire organizations or take up studies to support precision medicine efforts. This is a hypothetical company that has been tasked with identifying what kind of health decisions are required when it comes to breast cancer and what exactly can be done to improve patient outcomes and economic outcomes within breast cancer arena. So who the client is, like I said, it's a hypothetical major leading payer company, an insurance company. And why they're interested in this is because like a background of breast cancer would tell us that there is about $20 billion spent each year by healthcare in healthcare towards breast cancer treatment and diagnostics. And what is the goal? The basic purpose is to reduce overall health expenditure within breast cancer management, and to identify opportunities in breast cancer care pathway to implement precision efforts. Uh, and what are the assets and challenges of the client? Why can't the client, like the client has large payer data sets, but the client cannot, excuse me, the client cannot come up with these decision points because they may not have the capabilities of developing models. And there is always a challenge in finding right scientific evidence to back up whatever insights can be drawn from that. So the solution we offer at Albertine is a breast cancer precision medicine optimization platform. And what exactly this does is it is a software platform wherein the payers can take the information and put it in, like to find outcomes that would help make better clinical decisions, clinical and economic decisions. So just a background of how the basics of breast cancer. Breast cancer is a disease of uncontrolled growth of breast tissue, and symptoms, it may be asymptomatic, or it may be presenting as a lump in the breast or axillary region, that is in the armpit. Risk factors are age, family history, parity, body mass index, amongst others. Diagnosis is typically, screening is by mammography, and diagnosis is by biopsy and radiological examination. Management typically involves surgery, chemotherapy, radiotherapy, hormone replacement therapy in combination. And staging is AJCC staging is from stages 0 to 4. This is the disease burden and the economic burden of breast cancer, to illustrate how the greater incidence of breast cancer. About 330,000 new cases come up each year. Like, it is estimated that in 2021, there would be about 3,300 new cases, out of which 81% are estimated to be invasive, and the remaining would be in situ. There is a risk of every, like 1 in 8 women developing invasive breast cancer during a lifetime. And we lose about 44,000 patients, women, each year, which is the second most common cancer death in the US. About 3.8 million women live with a previous or current diagnosis of breast cancer. This is a cause of concern because there is a high rate of recurrence, which is about 12%. And all of these together actually increase the economic burden due to breast cancer to about 20.5 billion per annum. Depending on the stage at diagnosis, there could be a range of expenditure per patient. That could be about 80,000 in stage 0, and maximum is, estimated about 180,000 for invasive cancer. So in the methodology, these are the steps, overarching steps that were taken. The first step was to understand what the current guidelines were. So from studying into the current guidelines, we've realized that there are a significant number of authorities that have different things to say, which makes it very difficult for us to identify which pathway or which diagnostic criteria or which screening criteria to follow. So this could be like one of the challenges that providers also face. Further on, we conducted a literature review. This helped us gather facts and numbers from published literature. So this was to essentially develop an understanding of the current scenario, which is backed up by published literature. This also helped identify gaps and pain points. Next step was to develop a business impact model. I'm going to share the business impact model overview in the next slide. And this business impact model is then validated. So the base of this business impact model was by utilizing the data we found in the literature review. And the validation was conducted by utilizing data and insights we were gathering from a Medicare data set when we were partnering with another organization. And subsequently, with all these data points, all these scientifically backed up information, we developed a recommendation for a revised schema of care, wherein we identified at what points we could have opportunities to improve outcomes. So the breast cancer business impact model had that was divided into 3 parts, wherein screening and diagnosis and treatment. Patient information. We were not owners of the data that was required for this. So we partnered with another organization, which also gave us information to help validate whatever pieces of information we found from the literature. So this is the this business impact model is basically toggle friendly, and the client, that is the payers, could put in the information and the insights from their data into this and find how exactly and what exactly can be done, the impact that can be created by bringing about changes in the care pathway. This is a outline. This is an overview of the schema that was used for building the business impact model. And this contained this is the downward path of risk, identifying risk, and dividing patients by high and average risk, and screening methodology, and how there was compliance and non-compliance. And there was staging based on diagnosis and at what stage the diagnosis was made. And then profiling based on molecular markers and gene panels. And then subsequently decisions based on the strategies used for treatment. So putting all of this in perspective, plugging the numbers in would give insights that were required for decision making. So some of from the literature review and also from which was also backed up by the validation from the payer data, these were some of the key pain points that translated into bringing about a recommendation. So there was suboptimal screening compliance of under over the age of 44 years. Only 63% of the women were getting screened as guidelines dictated. And there were only about 46% of non-screening compliant women had a stage 1 diagnosis. And all of the other women who had a positive diagnosis were at a greater stage, versus that of compliant women within compliant women population, where 63% of the women had stage 1 diagnosis. There was a high false positive recall rates, and because of how each of the recall leads to about $582 of expenditure, overall expenditure that happens to that is caused because of false positive results is about 2.8 billion. Gene expression profiling is one other gene testing wherein we can identify how to categorize and stratify patients based on their risk profile. And there can be about 40% change in the chemotherapy prescription and how the strategy for treatment occurs, and subsequent follow-up also occurs. So these were some of the pain points. And from the pain points and from the data that we found, this is the kind of overview of opportunities and points where there could be change that is brought about to improve patient and economic outcomes. So there were definitely some limitations within this data, within this study. Some of them were that there was no significant data with a large power that we could find on compliance rates, and we only found study level data, and we needed to extrapolate that information to population level studies. And also payer data that we had, that we were using for validation along with our partner organization, was Medicare data set, which meant there was only data for ages above 65 years. And this becomes a challenge because the way younger women, the expenditure and the patient outcomes for younger women are way different than what women of 65 plus have for breast cancer. And with limited time on the project, we couldn't go deeper into phases 2 and 3, which is the diagnosis and treatment. And we had greater focus on the screening strategies. So some of the challenges were that, for me personally, economic aspects of healthcare is something that is new for me. So it was a significant new learning for me, and I definitely want to explore this aspect of healthcare more. And there's a vast extent of disease area like within breast cancer, and it felt overwhelming a lot of times, but it also like helped us gain a deeper understanding. And I realized there is so much more to do than just understanding the overarching basics of breast cancer treatment and diagnosis. The next thing was difficulty in finding the data as required, like I already spoke about, but this also was a good experience for me, as it helped me with the help of my manager, that is Mike. I was able to extrapolate and contextualize data that was available into what was required. That improved my logical thinking on the subject. So I will very briefly speak about my second internship. This was also a very dear internship for me because it was it's an internship that I worked with Claire and Shikha. It was very exciting because I was working with students coming from various backgrounds, and it was interesting. And it was just very exciting to see young individuals coming up into the class every day and asking questions and learning more and more about opportunities and avenues that they have for health informatics. I really wished I took up something like this growing up as a high schooler or in my undergrad. Perhaps it would have made like a significant difference for me. So it's basically enable is, it stands for extensible network accessible biomedical and health informatics lifelong learning environment. It's basically an online platform where you could educate yourself on the concepts of data sciences. It is open for everyone. It's an extension of CHIP programs, and it is free of cost. So there are 2 boot camps within Enable, and I worked for both. I worked as an instructor for both of the programs. The first program is HIDAB, which is Health Informatics, Data Analytics, and Visualization. The target population here, the target student population here was undergraduate students from underrepresented backgrounds. And the overview of how the education was provided for the students was the same in both of the boot camps. So it was didactic introduction to programming. We had data analysis. There was data visualization and concepts of how research methodologies are done in healthcare context. And there was also like a component of mentor hands-on project where for these undergrad students, we were the mentors, and they took up projects of their interest in groups, and they came up with an entire analysis from that project. So the purpose was to introduce them to opportunities and pathways in health informatics and spur interest with help of real-time projects. So it was, like having hands-on experience was very probably overwhelming for them, because not many of them had a programming background or healthcare background for that matter. But it was good. It was a great way of showing them that they can actually conduct a lot of research with very basic skill set. And other perks of this program was opportunity to meet people from experts from the field and learn from them, educate themselves, and throw themselves out there. And they some of them also like get internship experiences from this, and subsequent career progression as well. They also participate in journal clubs where they present papers, they come up with like interesting papers, and there was like a lot of activity that encouraged them to learn and be present. There was also career counseling that was provided during the program and also subsequently. It's a very interesting program. And the second bootcamp is data aware. This is a data analytics for teen advancement. Essentially, the curriculum is more or less the same, but the target population, the student population, is high school students from the Triangle area, from Chapel Hill, Durham, and all of that. And about 10 students come in the program, and they also have a faculty mentor or an expert in the field mentoring them to do projects. So they take part in the projects that are already going on. And even this program is to introduce them to basic concepts of data analytics, and they gain all of the knowledge with a little bit of less focus on the programming aspect of it. The perks of this is, again, they engage in with experts in the field, and they can explore their interests further. And Claire also had a lot of educative fun activities that she made sure everybody participated in, and I'm sure like it was a great experience for them. So personally for me, as the instructor, some of the roles that I had was instruction. The program was essentially asynchronous online program this this semester, and there were also like some synchronous classes where I had to teach biostatistics and epidemiology and research methodology concepts, and I predominantly took care of data mining aspects of the classes. And like you can see on the right side, there is text mining modules, data mining modules within the curriculum, and there's also data visualization and programming. All of this is available online, and the code is available on Jupyter Notebook, and there is a data set that is already embedded, and you can see how programming is done at a very basic level. The second role I had to play was being a mentor. I oversaw the journal clubs, and I had one-on-one guidance sessions with students. It was a great experience. Besides that, I also was playing a small role in looking at the quality assurance of the Jupyter notebooks. We needed to make sure that each and every cell and each and every module worked perfectly well, as it was the expectation that we were setting for students and upcoming students as well. And yeah, with the help of Shika and Claire, I was making like crucial decisions as to what is appropriate for the population of student that we have and what is not. And finally, I came up with a sample project that students could utilize in their individual group projects. And the next slide is speaking about that. So I worked on, I developed a sample project on the data set called stroke prediction data set, which is an open source data set available on Kaggle. And it was done on language R, and it was a CSV file. And this is an example of how I made the code and how I explained that in the pseudocode, in the code before that, in the cell before that. So the students just took these codes and this code, and they put in their data variables, and they conducted the analysis. So these were the several steps that I had in mind that the students should go through, like for a data analysis project as a secondary data analysis of patient data. And I ensured I had the most basic code so that it wouldn't cause a lot of confusion for the students, as they had barely any programming experience. So some of the challenges and lessons that I had during this part of the internship experience was that first thing was the notebook related. I did not have much experience working on Jupyter notebooks, although I worked with programming languages before. I did not have experience working with R per se, but I worked on Stata and Python. And it was interesting to see how, although it felt a little challenging in the beginning, the uh, learning curve was quite smooth. And of course, as with any other internship, there was challenges to meet, depending on the remote environment and how all of the young students were handled during remote classes. All in all, I feel both the experiences put together, I had a wholesome, complete experience. It felt like a whole circle, wherein in Enable, I was working with data analysis and understanding basics of how data analysis is conducted. And in Albertine, I was taking the information that from previous analysis that was already conducted from the literature and contextualizing it into actual application. So these are all the skills I felt I definitely utilized during my internship experiences.